Hi, my name is Justin Hoffman, and I will be presenting Ribavirin delivery procedure in line with a mechanical ventilator. The purpose of this is to support the hazardous drug policy and to direct the respiratory therapist in the setup of the small particle aerosol generator, also known as the SPAG, for the administration of ribavirin, which is also called Virazole. Ribavirin is a high-risk hazardous drug, and all employees should review the safety precautions and required notifications outlined in the hazardous drug policy to minimize worker, visitor, and patient exposure prior to initiation of therapy. The SPAG-2 is a small particle pneumatic aerosol generator designed for use with ribavirin. The mean particle size is about 1.3 microns. Treatment time is 12 to 18 hours. And also lasts 3 to 7 days and is used for the treatment of RSV or respiratory syncytial virus. The medical director and the supervisor who is on shift need to be notified prior to administration. To initiate this therapy, you need to connect the SPAG to a gas supply, turn off the drying air flow meter, adjust the nebulizer flow from 6 to 10 liters per minute, and adjust the regulatory pressure of 26 plus or minus 2 psi. Now the drying airflow meter is turned off due to its setup in line with the ventilator, which is shown in Figure 1. Next, you need to connect a T-piece to the drying chamber, which is shown in Figure 2, and connect a large bore tubing horizontally from the T-piece to the PEEP column, about 3 to 5 links. Figure 4 shows the PEEP column and bacterial filter. When setting up the PEEP column when the patient is on the ventilator, the water level should be 2 to 5 centimeters of water above the set PEEP on the ventilator, and the max is 15 centimeters of water in the PEEP column. And we will get to why you need to set the PEEP higher than the ventilator later in this presentation. Okay, Figure 5 again shows the T-piece adapter from the drying chamber with the vertical port leading to the humidifier in Figure 6. There should be approximately 8 to 10 links of tubing between the T-piece to the humidifier. To connect the tubing to the humidifier, you need to place the T-piece adapter on the wet side of the inspiratory limb, which is connected to a one-way valve from the drying chamber as shown in Figure 7. Figure 8 shows two bacterial filters between the end of the expiratory limb and the expiratory filter on the Puritan Bennett 840. Now this large picture shows the entire setup from the SPAG to the humidifier with corresponding arrows of flow. Now once your setup is complete, now is to make sure that you are able to maintain the circuit and the whole setup for the SPAG, which means changing the inspiratory bacterial filter is needed, change the two expiratory bacterial filters every 2 hours and is needed, and when using the Puritan Bennett 840 ventilator, change the expiratory filter daily once the medication is done running for the day. One of the most important pieces to your setup is your nebulizer. So once the medication is dispensed into the medication flask, proper function needs to be assessed. All 3 orifices need to be spraying correctly on the wall of the flask, which is shown in Figure 10. Ribavirin should be nebulized at a rate of 12.5 to 15 milliliters per hour. And finally, place a piece of tape on the nebulizer flask to mark the initial level of medication prior to administration to assure proper nebulization. I will now cover isolation precautions for ribavirin. So during medication delivery, a PAPR or N95, gloves, gown, and shoe covers must be worn. The patient is also going to be in a negative pressure room and in isolation. And if wearing an N95, you should have on goggles and a hairnet as well. However, when medication is not running, full protection for 1 hour after the medication is stopped, and then you can enter the room as you would just as contact precautions only, so just gown and gloves. Healthcare workers who are pregnant, possibly pregnant, or nursing should not be exposed to ribavirin. Due to possible causes of birth defects when females are exposed to even low doses during pregnancy. And ideally, medication delivery should be done from 9 p.m. to 9 a.m. to minimize the amount of people needing to enter the patient's room. Now on the cleaning and sterilization of this bag. First, you need to discard any unused portion of the medication down the toilet and flush, and all wetted parts should be cleaned with soap and water and left to air dry daily. And those two are going to be your drying chamber and the reservoir flask assembly, or the medication cup. And you also need to change the corrugated tubing daily. Ventilator circuits also need to be changed daily, but use discretion based on the amount of PEEP and FiO2 they are on. You also need to wipe down any external surface of the ventilator with a disinfectant wipes daily. And after the last treatment of the day, clean the parts and send the entire SPAG unit to central processing for sterilization in a red biohazard bag. What to watch for when you're using this bag in line with the ventilator circuit. So to account for the increased PEEP, you need to make sure the sterile water level on the PEEP column is 2 to 5 centimeters above the set PEEP on the ventilator. Also, the user needs to be aware that falsely high exhale tidal volumes will be recorded due to the extra flow from the SPAG unit. Here are some references that I got my information from, and I hope you enjoyed this presentation. Thank you.